Okay, everybody, good morning. We are the OCD team here. And before we get started, I guess it's better to introduce ourselves. I'm Kushan Gayathra Perera. I'm from Sri Lanka. And currently I'm working as a university lecturer in development studies attached to a faculty of social sciences, University of Kelaniya, Sri Lanka. And same time I'm working as a development project consultant, specifically about regional development projects. And in Sweden, I'm reading my master's degree at Stockholm University in Urban and Regional Planning.
Yes, I'm Alice Allwin, and I'm an organizational developer, usually, when I'm not taking this course.
My name is Celine, I'm from Germany, and I'm studying sustainable development, and I have a background in biochemistry.
My name is Iqra. I'm currently studying my master's in user experience, and I also have a background as a computer engineer.
Hi, I'm Indu Negi, and I'm an occupational therapist.
Hi, I'm Öykú. I'm a master's exchange student. I am studying mechanical engineering in Finland. And also we have Kago, which is also exchange student, but he's not with us right now. And Julia, she was with us in the first semester.
Okay, as you can see here, this was our initial challenge. And this set the stage for us for our journey. And once we got assigned with this challenge, we knew that we're gonna need informative, innovative, and collaborative approach in order to tackle with them. And therefore, as a team, we decided to start with the initial discussion with our challenge giver. And she is with us today, Diana Pascal, in Psykatri Sydväst. I hope I pronounce it correctly. Yeah, Stockholm style. And once after that initial discussion, we realized that our challenge is multi-phased, and of course it is way more challenging than we was expecting. And after that, as a team, we decided to come up with a stakeholder mapping, because we believe that we have to have a good kind of a understanding about the healthcare system in Sweden, particularly in Stockholm. So we believe that stakeholder mapping can help us in that case. So we developed a stakeholder map, and after that we get a clear insight about the key players which is relevant with this particular challenge, and not just identifying the key players, but the interaction with them, and of course the gaps between them. And after that, then we decided to reach them in an in-person manner. So we believe that after having some discussions with them, it may help us to get more understanding about the challenge in their point of view. I mean, to empathize the challenge in the particular intended recipient's stage. And therefore, we decided to create some posters, as you can see here. And we just outlined our project or the challenge in here, and I've designed this poster in 2 languages, that means in Svenska and English. Then after that, we presented it, or we published it in libraries, universities, and of course at hospitals and so on. And believe me, luckily it's worked. It helped us, it provide us accessibility for a number of intended recipients, or the people who are living with psychiatrical conditions, and same time the healthcare workers who has engaged with psychiatric health. And as a result, we got 16 responses, and 7 was volunteered. Those people was people who living with psychiatrical conditions. And of course, 3 interviewees was mental health care professionals. And once we done with these interviews, especially with these 7 interviews who are living with mental health conditions, they give us a great deal of insight about the experience that they are having with. And same time, these 3 mental health professionals, they shed a light on the pros and cons and what is exactly happening there. And those experiences helped us to empathize the question and get to know what are the challenges, what are the opportunities that we have.
So yeah, as after collecting all these interviews and surveys, we got some valuable insights which I'm going to share. So there is a lot of stigma. We have noticed that a lot of people don't seek help because they are afraid, and so they will be being judged. And we also noticed that long wait time for care was also very frustrating, and it was also worsening their symptoms, they mentioned. And need for social and peer support. People also mentioned that they want a place or where they can go and they can talk to someone who can understand their needs. And we also noticed that lack of awareness and education, both within the families and within the society. They don't know how to cope with all these things. So after all these valuable insights, when we collected this data, we refined our challenge, and we thought about that seeking help early on and creating awareness is very important. So we redefined it that how might we motivate people to seek help early on and empower them with necessary support and knowledge to create habits that benefit their mental health. So after redefining our challenge, we came up with 5 promising concepts. So our first concept was a mentor and buddy program, a program that connects people with shared experiences, like a mentor and buddy, they can talk to each other. And our second concept was up and down bus, very colorful double-decker bus where they can go and they can talk to people, and they can have tea. So our third concept was a mental health festival, a very welcoming space to promote acceptance and learning. Fourth concept was well-being education. We were thinking about transforming the education into so that students can have early on help and they can understand all these problems early, so it would be easy for them. And our fifth concept was Live Space. It was an app we thought about, and training AI assistant so that they can get emotional support, and it will help them managing their routines. So after all these concepts, we performed some testing, and my colleague will share that whom we tested and how.
Yes. After the half-time presentation, we got some valuable feedback, and talking with our challenge giver and so on, and we made a concept selection. We thought that the Body Mentor program, the mental health festival, and the Up and Down bus was the most promising. So we decided to develop some prototypes for these and test them further on. What we did was we took these three concepts and connected with the interviewers we had earlier on in the project, and also we went to Fountain House Stockholm, where persons that had some experience can go, and after that we needed to reflect some more about the concepts, and it turned out that the mental body program was maybe got some mixed feedback, and it seemed a bit tricky to carry out, so we ruled that out. But both the mental health festival and the Up and Down bus got really good feedback, and in the end we decided to go with the Up and Down bus because we thought it was more concrete concept, more fun, and a slightly more innovational height. And after that we took that final concept, we developed it even more, and we tested it at Östervägens Aktivitetshus, that is also for persons with experience of mental health issues, and also went to our challenge giver, Psykatri Sydväst, and especially the OCD-programmet. And here is one of our prototypes. That is a Lego model, as you can see, but we also made more prototypes like pamphlets, posters, and a video to really try to explain our concept.
And after all the feedbacks we got and the evaluations we made, this is our last concept, the Up and Down bus. The name is coming from, like, we have a double-decker bus. We can go up and down, and also life has also up and downs, and we are welcoming everybody in every stage of the mood, and welcome to come, and welcome as you are. And these are the services we are planning to give. There will be 3 people in the bus, which one of them will be the driver and the cafe person, and one of them will be counselor, and the other one will be social worker, which could be like either we can hire and or it could be part-time or like volunteer, yeah. And there will be also cafe parts, which we will give nutritious smoothies and teas, and also healthy foods like snacks. And there will be also some activities like games and books, which will be related to mental health, and people can just come and as a group and just socialize in the bus. And the information we will give to the people coming will be about like mental health issues, which kind of mental health issues there are, and how to seek help if you need, and how to start your journey to get better, and also addressing some myths and misconceptions to break the stigma around the mental health issues, and also if there are any groups and associations that people can join and be a part of the group. For whom is this bus? This bus is we mainly wants to target people who having mental health issues, either diagnosed or not, or it could be people having relatives or friends having these kind of issues and they want to support and want to learn how to support them. But most importantly, we are welcome everybody which is very which is curious about these kind of issues and wants to learn more.
Then we decided that the bus should be rotating, and we thought it might be best if at first it could be like at 5 different locations in Stockholm where it rotates and stays at one location for 1 day, and that for the people to know where the bus are, there will be a website where you can see the location of the bus and you can see also the schedule from where it moves each day. Then activity-wise, we thought we would like to focus on some group sessions, so more like some kind of peer support groups that are but supervised by a counselor. And we also thought that it might be good to have like changing topics and focus, so that, for example, you have a day where you maybe talk about nutrition and mental health, or maybe a day where you talk about ADHD or OCD or certain problems that arise. And then there will be also a schedule for that can be found on the website, so that people know when will be what and where they would like to join. Then further on, if our concept will be like established a little bit, we thought it might be very nice to have some cooperations with, for example, schools, elderly homes, and organizations like Fountain House, so that we like schedule extra times for that, and the bus goes to the place, maybe has some lectures about mental health in general and about the concept of the bus, so that, for example, elderly or kids are informed about first that mental health is a thing, then to talk about stigma, and they also know that the bus can be a place where they can go and to find some support. And here we also have a poster for some advertising of the bus. You also find it on the table, so that people become aware that that exists, and there's also a QR code where you find the website with the map and the schedule. And here we have a little prototype of how it could look inside of the bus. So the top deck, which is more for like the group activities and for in between to just chill, play games and stuff. And on the bottom deck, it's more for the cafe and get maybe some information.
Yes. Here's some feedback that made us sort of make this into our final concept and made some alterations. People really liked generally the visibility and the accessibility of the bus. That really stood out, that it's going to be colorful, that we want to have this small theme, like we mentioned. It's going to be something similar to the ice cream truck, but maybe a bit more nice. And also the cafe element is really important, because food brings people together. If you give away something small, it's a very good way of inviting and saying welcome. The part to give guidance about the healthcare system and how to seek further help was valuable, they thought, and also this part of focusing on lifestyle factors was quite appreciated. and also that this is a social solution in the society where we have a lot of digital connections. It's also important to have a place to come to. Some of the more negative factors or maybe risks that we got was that the security and the work environment must be addressed. So if someone shows up that are maybe aggressive or maybe are suicidal, that needs to be handled so that the people being there could feel safe. And unfortunately, current healthcare regulations make it a bit hard for us to include, like we thought in the beginning, maybe include some more psychiatric treatments on the bus, like drop-in sessions. So we made the sessions more about peer support. And also we had some thoughts about that we give information, we want to sort of give correct information that is so important, but we need to also think about that we can risk of oversimplifying like complex diagnoses and diseases, so that we are that we are aware of that. And of course the weather dependence, because it is a bus and it's in Sweden, it can be rain, it can be the winter and everything, and of course that might make fewer people come. But like you maybe saw in our pictures, we put them there on the whiteboard as well. It's like we try to make it even more that you can be inside the bus and be there.
So now we have learned about this concept and how and what the bus will look like. But then to make it a reality, we have to consider some other factors and also see what requirements are there. And if we're talking about a bus that looks this nice, there is a cost attached to it. And we tried to make a rough estimate of how much it would cost to have such a bus. And here it is the breakdown of the cost. It is the rough estimate to best of our understanding. It can vary. But we thought maybe have a second-hand bus to keep it more sustainable and also a bit more economical. And then even initial investment in annual operating costs, where we talk about the salaries and the fuel and other logistics of having such a thing. And the total amount comes out to be a good amount. And how do we justify this? And it's only about one bus. So let's look into the figures here. This is for 2024. The total cost of mental health issues in Sweden. And it's not the whole healthcare cost, but it is all direct and indirect costs that mental health issues cost. And also part of it is the mental health system that has this cost, but also people suffering from some issues and are not able to either work or then obviously they need some kind of social welfare, so that cost and loss of productivity. So everything comes out to be this 320 billion Swedish crown, and that's a good amount. So for that, having around 200,000 crown was not, now it looks like a reasonable cost, but still just to make it a more do the cost benefit analysis. So what benefits are from this bus? So definitely the social benefits that we have been talking about, and those were the biggest concerns of people with mental health issues or people we interviewed, that they lack a support system. They also are afraid to take help because there's stigma attached to it, and also having such conditions reduce their quality of life because they cannot participate socially. So the bus actually will target all these concerns, where when we provide this information and normalizing that it is part of life and it's up and down and everybody goes through it to some extent. So making it more open and out there and reducing the stigma, and also this bus where people can come having concern or not, trying to learn more about different conditions and how they can be helpful. So providing a community, and also when you are there and trying to participate in some extent, then obviously improving that social participation factor. And then definitely we don't like to talk a lot about money, but it is also an important factor. So by proactively dealing with these concerns or making people more aware and making it normal so that people seek help early on and acting more proactively and preventatively. So maybe reducing the long-term cost that we saw just now. So that is the attempt. And then what we need to make this concept a success. So definitely we have already spoken about different partnerships that can be there. So partnership for maybe having those staff that we're talking about, maybe in collaboration with some centers or care providers, or also they provide training to our staff and resources and everything that is available that we can share with people who need to know about it, and also funding, getting some sort of funding, donations, so that we can run this bus that has a everyday operational cost, and also getting our staff trained, as I mentioned, and then some partnership can be if we want to have such nice looking bus. Can we collaborate with some design school where students can have their projects and they design and create this bus? So like the whole society in a way being the contributor of this concept, not just healthcare professional or just one part of the society. And then by everything that we try to bring today to the table, and also this concept providing the support in community, and also reducing, even if it's a fraction of the cost that we talked about, it would be saving billions, hopefully, annually. And then we are hoping that if this concept can be done as a pilot in Stockholm with those 5 sites that we showed, and then there is a possibility of scalability, and then we would really like to see it throughout in other regions and in Sweden. So this is what we have for you today. And now we would really like to thank our challenge giver, Psykatri Sydväst and Diana, and for giving us this opportunity and being there throughout this journey for all our questions and guiding, and even having this discussion and making us actually come up to this solution today. So thank you.
Thank you.